Toxicologist. He'll discuss chemical threats in Virginia, the public health implications of them, and how VDH would respond in a chemical emergency. And with that, I'll turn it over to you, Dwight.
Good morning to everybody. I'd like to thank Betsy and Nancy for the opportunity to speak today about chemical threats. The goal of the talk is to provide background information on a handful of chemicals, talk about how they affect health, provide some real-world examples of releases, and then talk about the health department's role in addressing a chemical event. So let's begin with a few questions and answers about chemical releases. First of all, where do they occur? Well, chemicals with the potential to harm the public can be found everywhere and can be released from facilities that store or make chemicals, or even in homes where methamphetamine is made illegally. There are approximately 14,000 chemical facilities in the United States that store or use hazardous substances that could kill or cause serious harm to workers or nearby public if such substances were released. There are more than 450 chemical plants near or located near populations of 100,000 people or more. In Virginia, there are approximately 4,400 Tier 2 facilities. A Tier 2 facility is a facility that stores, uses, or produces chemicals that require a material safety data sheet, or an MSDS. And what an MSDS provides is chemical-specific information such as health effects from exposure, tells you if it's flammable, and even how to clean it up if you spill it. So what about transportation releases? Where do they occur? Well, there's an increased risk among the general public to exposure from spills and releases along corridors such as highways and railroad tracks used to transport chemicals across the country. In 2010, there were 217 fixed facilities and 85 transportation chemical releases reported in Virginia alone. So our next question, how are they released? The majority of chemical releases are accidental and are usually the result of equipment failure followed by human error. And less than 1%, or about 0.5%, are intentional. Lastly, the question is, when do they occur? Most releases occur anytime, of course. They're not on any schedule, but they do occur between 6 a.m. and 6 p.m. The deadliest chemical release from a fixed facility occurred in India. In 1984, in the middle of the night, about 2 a.m., 40 metric tons of methyl isocyanate was released from a pesticide plant in India, injuring over 100,000 people and killing 3,000 people. This led to the Emergency Planning and Community Right to Know Act passed by Congress in 1986. Congress mandated that EPA maintain a list of extremely hazardous substances manufactured, stored, and used in the United States. The act also called for the distribution of material safety data sheets to the local fire departments and required that information about extremely hazardous substances be made available to the public so they know what types of hazardous substances may be found in their communities. A little bit about methyl isocyanate. It's used in the production of pesticides, foam, and plastics. Exposures to low levels might cause eye and throat irritation. Higher concentrations of the gas could cause your lungs to swell, making it difficult to breathe. This is one of the chemicals that it may not happen right then and there. It may take a day or two for you to develop difficulties in breathing. And of course, exposure to high enough concentrations can be fatal. So the chemicals that I'll be speaking briefly about today are the ones that are underlined. And many states and federal agencies maintain a list of chemicals that are released at fixed facilities and during transportation accidents that threaten the environment and the public. The majority of chemical releases are acids, bases, volatile organic compounds, and chlorine. And looking at chemical releases reported by various agencies, looking at top chemical accidents reported, and then those that happened during shipping, that's how I came up with the ones that were underlined. A couple of things that I'd like to point out is that 75% of all releases occur at fixed facilities. Most victims report respiratory irritation followed by eye irritation. Less than 10% of chemical releases result in hospital admissions. More than half the victims are usually employees, followed by the general public and emergency responders. And I'd like to point out that chlorine releases occur less frequently than any other listed. However, it produces the most fatalities. So now I'd like to provide some brief facts about chemicals and present some real-world examples of their releases and impact on health. All right, so the first chemical I'm going to talk about is ammonia. Ammonia is a colorless gas with an intense irritating odor with many uses. Its primary use is as a fertilizer and refrigerant. It's also used in many industries, including pulp and paper, textiles, pharmaceuticals, explosives, and household cleaners. It's corrosive and damages the site of contact, for example, if it comes in contact with the skin, eyes, or mouth. Anhydrous ammonia is stored as a compressed liquid in tanks on farms. And when released into the environment, it is a gas. It's lighter than air, so it does not settle into low-lying areas. But like many gases, exposure can occur quickly and result in numerous injuries. Ammonia is also a key ingredient in the illegal production of methamphetamine and is therefore routinely stolen. Now I'd like to go over a couple of scenarios. Ammonia release occurs frequently in facilities that have extremely large refrigerators, such as grocery stores and food processing plants. Recently, an ammonia leak occurred in Edinburgh, Virginia, at a poultry processing plant on the roof. The ammonia made its way to the interior of the building. It forced the evacuation of the plant and 12 nearby homes. One of 6 employees that received medical evaluation was sent to the local hospital and treated for chest pain and difficulty breathing. I'd like to point out in this example, the health department was not contacted, so I thought I would share why. At many facilities that store, use, or produce hazardous chemicals, they have their own hazardous material response team. And during a chemical release such as this one, the fire department was contacted when the release occurred, and the fire chief assumes the role of the incident commander. The Virginia Department of Emergency Management was contacted by the fire chief just to ensure that the facility's hazmat team was responding appropriately. I'd like to talk about a couple more scenarios that aren't on the slide. First one, in 2000, approximately 1,000 pounds of anhydrous ammonia were released from someone intentionally opened a valve in the middle of the night at a fertilizer dealer. The ammonia release caused 300 residents to be evacuated from their homes, and 2 persons reported respiratory irritation. Ammonia theft has been almost weekly occurrence at that facility and is thought to be stolen to make methamphetamine. Another one, in 1999, 1 person was killed when a makeshift container of anhydrous ammonia he was holding exploded in a car. The ammonia was to be used for making methamphetamine. A couple of emergency responders and 1 member of the general public, all who stopped to help, was also injured as a result of the ammonia release. Moving on to chlorine. Chlorine is a gas that's heavier than air. It has a greenish yellow color and has a suffocating odor. It's used in the manufacturing of plastics and water treatment and in pulp and paper bleaching. Chlorine was also used as a chemical weapon in World War I. Because chlorine is heavier than air, it will remain low to the ground when released in the environment. It is extremely reactive and not expected to last long. However, given the right conditions, chlorine gas cloud can travel great distances. It's one of the top 5 most released chemicals from a fixed facility. It's consistently among the 10 highest volume hazardous materials shipped on railroads, and as I mentioned before, it's rarely involved in transportation accidents. However, when it is, it does cause serious injuries. I'll go over a couple of examples. First one, at 2:40 a.m., a train carrying 3 tanker cars of liquid chlorine crashed into a parked locomotive in South Carolina. 46 tons of chlorine was released immediately, followed by an additional 14 tons over the next 3 days. Within an hour of the accident, a reverse 911 call went out to the residents telling them to shelter in place. Roads were closed and decontamination stations were set up immediately. Anyone leaving the area was intercepted and taken to be decontaminated. About 600 people sought medical care, 12% were hospitalized, and 88% were examined and released. Now, as I mentioned, when chlorine is involved, there's usually deaths. In this case, 9 people died. 7 of those that died were within a quarter mile of the release, and the other 2 were within a half mile of the release. The most reported symptoms were coughing, followed by burning eyes and shortness of breath. In our second scenario, 8 people killed and 88 others injured when chlorine leaked from a derailed railroad tank car in Florida. The chlorine gas cloud traveled down a hill and settled onto low areas on a nearby highway. Cars that were passing through the gas cloud stalled. Drivers were overcome, resulting in the injuries and the fatalities. And then another example of chlorine, not on the slide, a chlorine cylinder fell from a truck in a hotel garage in Georgia. 33 people went to the emergency room, including 10 emergency responders. Moving on to sulfuric acid. Sulfuric acid is a corrosive oil. More sulfuric acid is produced in the United States than any other chemical. It has multiple uses that include manufacturing of fertilizers and explosives. It's used in the purification of petroleum, in the pickling or washing of metals, and in lead-acid batteries. 68% of sulfuric acid use in the United States is in phosphate fertilizer production, where it's used to convert phosphate rock to phosphoric acid. Sulfuric acid is very corrosive and irritating and causes direct local effect on anything that it touches, such as the skin, eyes, or if you were able to drink it, the GI system, when in sufficient concentrations. The fumes can irritate the nose and throat and cause difficulty breathing. Also can cause burning of the eyes and possibly result in blindness. So a couple of examples. The first one, on a Sunday afternoon in Tennessee, a train derailed. A rail car containing sulfuric acid was punctured, releasing a cloud of toxic sulfuric acid fumes 3,000 feet into the air at one point. 9,600 gallons of fuming sulfuric acid was released. The fire chief ordered an evacuation minutes after arrival on scene, and the evacuation was implemented by the sheriff's office. It was 9,000 residents in the area needed to be contacted. However, because it was Sunday, most were at church or away from their homes. There was also a charity bike tour in progress and a fishing tournament taking place as well. Local radio, television, and a reverse 911 calls were utilized to help evacuate the area. The evacuation was complicated by the fact that during the evacuation, people were not aware that they would not be allowed to return home for a couple of days. This left pets stranded and people without medication. There was also special need individuals, elderly, and a recent heart-lung transplant patient needing assistance. There was a 4-hour window identified the next day, and when residents had an opportunity to go home and remove stranded pets or get medication. However, communicating this led to confusion, and the sheriff's office was needed to control an upset crowd of residents. Residents were eventually allowed to go home a few days later. There were only a few minor injuries related to this incident, which was approximately 2 people were treated and released in the emergency room, and their main complaint was respiratory distress and eye irritation. In our second example, in Utah, in 2005, a mixture of sulfuric acid and a couple of other acids corroded the inside of a stationary rail car. The corrosion was attributed to the improper combination of the acids and was considered human error. A member of the general public about a quarter of a mile away experienced respiratory irritation and treated on scene. Approximately 8,000 people downwind from the release were evacuated for 5 hours, and a shelter in place was ordered for 5 blocks in the immediate area of the release. Now we'll talk about vinyl chloride. Vinyl chloride is a gas that burns easily and has a sweet odor. It's an important industrial chemical with a wide variety of end-use products. Approximately 98% of all vinyl chloride is used to manufacture polyvinyl chlorides, PVC. Vinyl chloride is soluble in water and can leach through the soil and contaminate groundwater. Vinyl chloride is also a product of the degradation of chlorinated solvents such as tetrachloroethylene in soil by bacteria. Breathing high levels of vinyl chloride will make you feel dizzy and sleepy or even give you a headache. However, breathing fresh air after exposure to vinyl chloride will lead to a rapid recovery of these effects. Vinyl chloride is a known carcinogen. Couple of exposure scenarios. In New Jersey, a railroad bridge buckled under a locomotive causing several train cars to fall into the waters below. Vinyl chloride leaked, sickening at least 18 people at a local marine terminal. The affected individuals reported breathing problems, and a half-mile radius around the train derailment was cleared to prevent others from being exposed. And our second example happened in Germany. 10 tank cars filled with vinyl chloride derailed, with one of them exploding and 4 others catching fire. 4 individuals suffered burns. A total of 28 people received inpatient treatment, and another 268 people were treated as outpatients. Symptoms included headache, nausea, respiratory, and eye irritation. Vinyl chloride continued to be released over the next several days. Groundwater was analyzed, and vinyl chloride concentrations was reported to be as high as 73,000 parts per billion, which is definitely a public health concern when you consider that the safe drinking water or maximum contaminant level allowed in a public water works is 2 parts per billion. Since tetrachlorine release into the environment occurs frequently in Virginia, I thought it would be a good one to present in addition to the other ones. Tetrachloroethylene is an organic solvent that is a liquid at room temperature. It readily evaporates into the air and has a sweet odor. It's used primarily for dry cleaning fabric and as a metal degreaser. It has been used safely as a general anesthetic agent, so we know that at high concentration it's known to produce a loss of consciousness. Single inhalation exposures of high concentrations produce effects similar to alcohol intoxication. Skin irritation may result from repeated dermal contact, and although it has not been shown to cause cancer in people, the U.S. Department of Health and Human Services has determined that it may reasonably be anticipated to be a human carcinogen. In the past couple of years, tetrachloroethylene has been detected in groundwater and private drinking water wells in Virginia. Because it is volatile, it can migrate from the groundwater to the surface and collect in the air of homes and other surfaces above ground. The exposure scenarios are typically as follows. Groundwater contamination was identified through an environmental investigation, whether it was evaluating putting a private well online or part of an evaluation of a property being considered for purchase. In each scenario, the concentration of tetrachloroethylene in groundwater was extremely high and warranted the evaluation of nearby private wells to determine if they were impacted. So in one incident in Virginia, the concentration of the tetrachloroethylene in a private well was 1,000-fold above the safe level, which 5 parts per billion is the maximum contaminant level for tetrachloroethylene in public water works. This led to a survey of private wells in the area. It was identified in a nearby private well at 3,000 parts per billion. Now, in a separate incident, tetrachloroethylene was identified in groundwater at 18,000 parts per billion. So this too prompted public health response to determine if nearby private drinking water wells were impacted. It was found in one well at a concentration of less than 1 parts per billion. Now, as I mentioned, it is volatile and can migrate into homes above the ground. So high levels of tetrachloroethylene in groundwater suggest the need for indoor air sampling. Indoor air samplings usually result in concentrations of tetrachloroethylene and other volatile organic compounds that are consistent with what you would expect in a home anyway. So moving on to the second half of the presentation, it will be about the health department's role in addressing an event involving a chemical release. The Office of Epidemiology has a chemical response plan. It can be found in the Virginia Department of Health Emergency Response Plan. Some of the areas covered in the chemical response plan include basics of chemical agents, how to identify chemical release through surveillance, planning and preparing for a chemical release. It also has contact information in it as well as a form in the appendix that can be used to capture pertinent information that can be shared with others. The form is a great tool because it allows the local health department to capture information that then can be used when writing an event notification. It also can be shared with others that would be involved in evaluating any biological or environmental sample data. In the general incident command system structure for the health department, there are 4 sections: 1, operations; 2, planning, logistics, and finance. Within those, the Office of Epidemiology is under the operations. And within the Office of Epi, it has 3 groups: surveillance, investigation, and information. The purpose of the surveillance group is to support efforts to efficiently and accurately receive, manage, analyze, and summarize data to determine the scope and progression of the event. The purpose of the investigation group is to carry out case and contact information, collect information on illness and exposures that may be associated with illness, and to recommend and monitor compliance with measures designed to prevent additional illness. The purpose of the information group is to assess existing information and compile timely and accurate information for dissemination to technical and lay audiences on the magnitude of the event, the health risk, and the health risk associated with the event, and ways to reduce risk. There are different ways public health can identify a chemical release. Releases occurring at a fixed facility or during a transportation emergency response could come to the attention of the health department via the fire department, the Virginia Department of Emergency Management, environmental agencies, or even media outlets. A chemical release resulting in exposure can be identified at the health department through surveillance using active, syndromic, passive surveillance. Also, the Poison Control Centers are another agency that actively monitor emergency rooms and hospital data and alert public health officials when there is a substantial change in their baseline cases. Lastly, a chemical release can be detected through an environmental investigation. When state and federal environmental agencies identify contaminants in environmental samples, they share their findings with the health department, as in the cases of tetrachloroethylene contaminated groundwater. This is a short list of the many indicators of a chemical exposure that can be found in the chemical response plan. It can be used by the local health department to identify that a chemical exposure is taking place during an event that they may be monitoring, such as the Boy Scout Jamboree or the State Fair. Now I'll talk about notification. Chemical emergency reports from a hospital, a clinician, a laboratory, resident, local government, state, or federal government agencies should be shared between the health districts and central office immediately. If the local health department staff receives the initial notification, the local health department staff should immediately notify the emergency response team members in the district, particularly the district director. The local health department should immediately notify the regional epidemiologist or the division of surveillance investigation at the central office. At the local level, the local health department will notify law enforcement, local emergency manager, and local hazmat if necessary. If the division of surveillance and investigation or the division of environmental epidemiology is alerted about a chemical emergency before the local health department, they will of course notify the local health department immediately. This slide outlines the initial notification process in the central office and the flow of information. The director of either the Division of Surveillance and Investigation or Division of Environmental Epidemiology will notify the state epidemiologist and the Office of Emergency Preparedness at the central office. The state epidemiologist and the Office of Emergency Preparedness will notify the chain of command at VDH, including the commissioner. The DSI and DE will work with the local health departments to provide epidemiological updates to relevant districts, offices, and agencies that are involved in the investigation. And the central office will notify and coordinate with the appropriate state and federal entities. These may include the Virginia Department of Emergency Management, state police, Centers for Disease Control and Prevention, and so on. So now we'll go over some roles for local health department. The local health department roles include providing background information and defining the chemical release, or essentially what happened. Other roles include responding to citizens in the media with questions such as what happened, what are the health effects, and what is being done. When additional samples are necessary to determine if health is being impacted, the local health department would assist environmental agencies and local officials with collecting samples. During a chemical release, when individuals are displaced from homes, the local health department would assist with making sure everyone has access to doctors, medicines, and a place to stay, and food and water and shelter. The local health department should also identify the needs of the local government. Roles of the central office include identifying any acute or chronic public health implications that the chemical release may have, coordinating with state and federal agencies, including the Division of Consolidated Laboratory Services, CDC, the U.S. Environmental Protection Agency, Virginia Department of Environmental Quality. The central office will provide toxicological support, make recommendations for reducing exposure, and assist with determining when it's safe for the general public to return home or to the site of the release. In a chemical emergency, the central office will notify DCLS of the incident and assist with coordinating sample collection and analysis between agencies and the local health department. In addition, the Division of Surveillance Investigation and Division of Environmental Epi can help determine the type and amount of specimens to be collected. For example, clinical samples, whether blood or urine are necessary, and or environmental samples such as food, soil, water, etc. Also coordinate the distribution of sampling kits, provide instructions on the appropriate use of personal protective equipment needed for sample collection, storage, and shipment, and ensure that specimens are stored and shipped appropriately. During the recovery and post-event phase, roles of the health department continue. Some occur at the local level, some at the central level, and some jointly. Necessary activities would include continuing to implement measures to mitigate adverse health outcomes, revisiting the site as necessary to ensure that control and preventative actions are in place and effective, monitor the health status among responders and individuals, provide toxicological consultation on cleanup, and determining safe environmental contaminant levels for reentry into the area. Coordinating ongoing environmental sampling and testing as needed, and providing the community with emotional support and ensuring access to shelter, food, water, clothing, and medicine. There's never a shortage of public or media interest when there is a chemical threat. The best way to engage the public and media is by working with your public information officer. Although communication technology has advanced over the years, there are three important questions that we always need to be able to provide answers to. They include 1, what happened? 2, what we know, such as, is it dangerous? Will it make you sick? And lastly, what the individual can do, such as shelter in place, leave the area, boil the water, don't drink the water, don't eat the fish. Other deliverables that are useful to have during a chemical release include talking points, message maps, and fact sheets. The central office is available to help with developing these. In fact, we have employees hired to support our cooperative agreement grant with the Agency for Toxic Substances and Disease Registry, and they are ready to assist with this. I finished faster than I thought, but I would also like to acknowledge Dr. June Yang in the Division of Surveillance and Investigation. He was the lead author on the Chemical Emergency Plan and made it the great document that it is. And on the last slide is some context that were pulled out of the Epidemiology Chemical Emergency Plan. And that's all I have.
Thank you. So with that, I think we can open it up with questions. We have a lot of people on the line, so let's do it regionally. We can start with the folks here in the room. Does anyone here in the room have questions? No? Okay.
Have there been examples of more, I think most of the examples that you gave of chemical releases were accidental. Have there been more intentional ones?
So the question is, have there been any examples of intentional chemical releases?
No, just the intentional ones that I was able to find were the ones where I talked about people stealing the anhydrous ammonia from farms where they have large storage tanks of ammonia.
Okay, so how about anyone in Central Region?
It's Tom Frank from Chickahominy. In one of your slides, you mentioned the role of the local health department, and one of the roles being sample collection. Can you clarify and give some examples of that?
One of the examples is with tetrachloroethylene, where once an environmental agency shares with the local health department and us that there are contaminated, that the groundwater is contaminated, usually the local health department will do a survey of wells in the area and then either go out and collect water samples from those wells or assist the environmental agency when they go out and collect the water samples.
Thank you.
Anyone else in Central have a question? Okay, let's move to Western. Anyone out west have a question? Okay. How about Northern Region?
This is Western.
Okay.
Is Cumberland Plateau, is there any specific guidance for homes that have been used as meth labs, the cleanup of those scenarios?
Yes, we have the health department developed a methamphetamine cleanup guideline that is available. The environmental, it's posted, if not already. I can send you a copy of the guidelines. Otherwise, you should be able to find it on the environmental health website.
Okay, and I think you might want to remute your line. I think we can hear a little bit of feedback. No? Not yours? Okay, everyone mute your lines if you don't have a question.
Do you have a question?
Yes, this is Northern Region. You spoke about with the chlorine and sulfuric acid exposures that in some cases there was shelter in place and in some cases there was evacuation. How is that decision made and who makes it?
That's a great question. I don't have the answer to, but I'm sure it's probably made by the incident commander, who would be the fire chief. Because you'd have to take into account how much is being released, how it's moving, if it's moving at all, and then it depends on the chemical. But each scenarios that I've seen, they differ from one to the next. So I don't really know any particular rule of thumb for most large gas releases. I think it's safe to evacuate at least within a half mile, if not a quarter mile of the area immediately.
Okay, any other sites in the Northern Region have a question? Okay, last but not least, do any sites in the Eastern Region have questions?
I've got a question from the Eastern Shore. You mentioned these very high levels of toxic chemicals that entered the groundwater. Do you have any information about how long those high levels persisted? And another question is, I know you'd want to do initial testing, but would you want to do some sort of long-term testing to just in case there was a plume of contaminants that were moving underground?
Yeah. I've already forgotten the first question. I apologize. I meant to cut you off. You asked about the levels.
How long did those high levels persist?
Right. Now, with the vinyl chloride, there was actually another example where vinyl chloride contaminated groundwater in Canada. It wasn't 73 milligrams per liter, it was around 10 milligrams per liter. But what they found was that within a couple of weeks afterwards, it had already returned back down to baseline. So it would be something you'd have to continue to monitor. There's no particular rule of thumb how fast it would be removed. It would depend on, you know, the type of soil, if it's and the type of bacteria that's in it, aerobic versus anaerobic conditions, that kind of thing. Then to answer your second question about continue monitoring, yes, of course, like in the example with the tetrachloroethylene, the first well had 5,000 and then a nearby well had 3,000. In the second example, 18,000 was found in the groundwater, but a well nearby was only 1 part per billion. It's depending on the movement of the plume, which is usually going to be delineated or determined after there's contamination found. Yeah, you would have to continue to monitor, because although that one well may be 1 part per billion during that sampling event, if the plume continues to move, it's going to eventually pollute that well. So you need ongoing monitoring in those cases, and at least know the direction of the movement of the groundwater.
Thank you.
Okay, any other questions?
Hi, this is Portsmouth. You mentioned that there's the local health department's role is mostly surveillance, maybe advisory, and maybe public information response. I was wondering, do we have any authority, either from the commissioner's level or anywhere else, in terms of you know, I know Dr. Madsen's listening, and I know he had an issue with a house that the local authorities wanted him to get quarantined, or you know, just to be deemed uninhabitable. And he, you know, I know he struggled a little bit with what is our authority in terms of doing things like that. So, any thoughts about that?
Well, I guess I'm not the one to discuss the authorities. What I provided was things that are in the chemical emergency response plan, and also things that are what other health departments do, not necessarily in Virginia. So it may be more of things that are expected, but as far as the authority, I don't have the answer to that.
Okay, any other questions?
It's Bobby Parker out in the Western region. How are you?
Fine, thanks.
Dwight, my question's about coal ash, and forgive me if you covered this, but I wonder if that's on the radar for your team, and if so, in what way?
Yes, it's definitely on the radar for toxicology. Our division director, Rebecca, has been out to meeting and attending community meetings. She was just at one last night, at one a couple weeks ago. The other roles that the division of Epi is taking in this is making sure that there's the appropriate fish consumption signage posting. We just finished reviewing fish tissue data this week and determined that there was no need to change the current fish consumption advisory in that area. We also attended meetings with the Office of Drinking Water and evaluated recreational water levels or contaminants in the river, not necessarily the treated water, to determine if it's safe for people to actually go in and swim in the water. So yeah, we have a role in that. We've also currently been asked to participate in determining if there's any risk from, I guess, drinking milk or eating animals or livestock that are actually grazing in the area, and that may, when the weather turns warmer, actually go into the river and drink the water.
Okay, any other questions?
This is David Madsen responding to Dr. Chang's prompt. The issue that we had was a first time ever meth lab suspected on the Eastern Shore. The authorities that the health district director had were to advise in that issue and to refer the building official of the county to the procedures for cleanup and assessment and cleanup prepared late last fall by DEQ and VDH in partnership. The building official had the authority to place a yellow placard blocking all admission to that site until the hazmat team had done its assessment and cleanup. And at this time, the building remains unoccupied, and now we're about 5 or so weeks since that. I know our colleagues on the western part of the state have much more experience with it. The additional fact is that since that finding, the county attorney prepared an ordinance for the Board of Supervisors, which they have considered, and I'm not sure if they've approved it yet, but it's either on their agenda or recently approved.
Thank you. Any other questions?
Yes, this is Diane Whalen in Virginia Beach. Can you hear me?
Yes, we can
Hello?
hear you.
Oh, okay. I have a question. Water treatment plants, sewage treatment plants, what threats do those pose?
What threats do those chemicals pose to them? Well, those chemicals in particular would just change the pH of the water, which the water treatment plant should be able to handle. If we're talking about the ones that I just talked about. And of course, you know, it may take the water treatment plant offline depending on how much time it takes for them to readjust the pH.
Okay, I think I heard someone else coming in with a question.
I think you were on mute when you
Okay, I'm okay. Yeah, this is Virginia Beach again. It's the same subject. What about chemicals released into the air via the process of them treating water and sewage and whatever?
Say that again. What about the tap water being released into the air?
Yes, sir. If there was, say, a leak somewhere in a pipe or something, and it wasn't necessarily into the water, but it was into the air, and exposed employees or whatever.
Well, it depends on what the chemical is that's in the water. Most of it's just going to be that it's going to change the pH, which would probably be bad for the environment, and you wouldn't want to get anything caustic on you, whether it's an acid or a base, could burn the skin. You definitely wouldn't want to drink it.
Okay, any other questions? Okay, it sounds like you have had a lot of questions answered. Thank you so much for the very informative presentation, and thanks to all of you for tuning in and asking great questions. Again, we didn't have an official sign-in sheet for today, so if someone in the room could pass around a sign-in sheet or email the names to nancy.phones@vdh.virginia.gov or fax it to her at 703-530-0510. We'd really appreciate that, and that would make sure that the course is completed in your trained transcript. And please also know that we are recording and archiving this session today, and it will be available in a couple of weeks. So please let those who weren't able to attend today know that that will be available. And we hope to see you again in April, on April 17th, for the presentation on biological threats. So thanks again, Dwight, for being here today, and thanks to all of you for tuning in. Have a good day.